What's up, everybody? I am so excited about this week's webinar, one, because I've missed y'all. We had to cancel our last webinar because our speaker got sick and she was unable to be here, but we've rescheduled Dr. Petrucco for October. But I'm super excited about this one because I haven't seen you guys in like a month, and because Kathy Mills Chang is here. And I really miss her like more than anything in the whole wide world, which is why we started exactly 1 minute late, because I had to cram everything, and I didn't. Everything I needed to say to her in 15 minutes. I still got lots to go. So if you don't know who Kathy Mills Chang is, I'm going to have to ask you, where the hell have you been? Because she is the most amazing speaker and educator in the world of chiropractic. She has been doing this a really long time, starting out in the chiropractic profession as a CA, then working with activator methods, the ACA, breakthrough coaching, now to have her own company, KMC University, which she's had for as long as I've been in chiropractic, because she started like right around the time I started in chiropractic. My education started with Kathy, who has been an incredible mentor to me. I miss the days when I got to follow her around all over the country, sometimes in a car up crazy mountains.
Right.
And I miss those days so very much. But I'm so excited because we have technology, so that if you haven't seen Kathy Mills Chang live and in person in the city near you, that you still have the opportunity to learn from her, because we want to bring you the best of the best. And that is Kathy Mills Chang. Kathy, I'm so excited you're here.
Thank you so much for having me. I've missed being here as well.
Yeah, it's like we've spaced everybody out so much because we're like spacing out the webinars, not doing them every week. But you know, we're gonna do a podcast this fall, so we'll have to definitely have you as a podcast guest too.
Always happy to help.
I have all kinds of stuff we could talk about on that, but I'm not going to take away from the exciting information Kathy's going to bring to you. So Kathy, let's see if we can get your screen shared.
All right. There we go.
Okay, now all you have to do is click on PowerPoint. So it's normal to see the 5,000s of us. And that's still not enough Kathy Mills Chang for me.
PowerPoint where? I've already done my PowerPoint.
There you go. Yeah, there.
How about now? Okay. My goodness. That's crazy. Okay, awesome. Well, I even took the time to open that one first. So sorry that didn't happen the way that it should have. I'm off to the races then on this great risk management topic. You know, it is very difficult to serve in a role in the profession where you feel like all you say is you can't do that, you can't do that, you can't do that. So what we really wanted to do was to offer up some opportunities to say, you know, what does good look like and what can you do? So we're going to talk a little bit about what an inducement violation is and why you want to avoid it. Really talk about what you can really give away if you want to on an initial visit, because you certainly can do certain things like that. To talk about how that new patient offer might come to fruition for you, and then to really understand that there's some sticky wickets around HIPAA that you have to be very careful of when you're doing marketing. So understand that you don't have to do social media and you don't have to market. Nobody says that you have to do it. But if you do want to do it because you are a business trying to run a business, you don't have to avoid social media, and you certainly don't have to avoid the marketing. But these are the things that you have to make sure that you're aware of. And probably, as with all the topics that we speak about the most, which are the hairy ones, right? Medicare and billing and documentation and compliance and those sorts of things. This is just really about being aware, because if you've ever worked in a restaurant, you know that they kind of divide it into the front of the house and the back of the house. And in our chiropractic practices, the back of the house is really the clinical side of the house. On the whole other side, though, there's a business side of the house that all of these sorts of things fit into. And 38 years in the profession now, what I can tell you is that rarely is there ever a hiccup on the clinical side of the house. Almost every time we see providers getting into hot water losing audits, those sorts of things. It is around the idea of what happens on the business side of the house. So we're focusing on that piece today, and then even that subset around really marketing and sharing information in a legal and compliant way. So we want to start with the idea of what is an inducement violation. So let's talk about the definition. And one dictionary states, an inducement is something that incites or has a tendency to incite a determination or action. Another says something such as the expectation of a reward that induces actions or motivates effort. So in our world, inducement is seen as anything that the business does, because remember, we're not Macy's or Walmart. We are a highly regulated healthcare business in chiropractic. So it is what a business does to incent a patient to see you versus another provider, particularly around the areas of federal law. And so this is actually what the provision states. I'm a huge fan of, I'm not going to tell you you can't do something without showing you exactly where it says you can't do it, because too many speakers out there today, unfortunately, just wave their tongue and say, you have to do this, you have to do that. They don't actually provide you with the reference. So this is the reference. It is the patient solicitation anti-inducement provision of 1128A. That Social Security Act is the Bible when it comes down to Medicare and federally insured people. This was enacted as a part of HIPAA. And it indicates that you could have civil monetary penalties if you offer or transfer to a Medicare or Medicaid beneficiary any remuneration. And any remuneration means anything of value that the person knows or should know is likely to influence that beneficiary's selection of a particular provider or supplier or of those Medicare payable items or services. Now, this is interesting because of what I'm going to show you next. And what they can do is fine you up to $10,000 for each act. So imagine if you're this guy in Iowa who was giving away muscle stim, that for every patient, every visit that muscle stim was given away, if they really wanted to have thrown the book at this doctor, they could have done so to the tune of $10,000 per. Now, here's why. You and I probably are very clear that this doctor, whoever they are, likely did not sit and cogitate on what can I do to get people in the door so that I can bill Medicare for this adjustment. And I guarantee you that even if he did not say, ooh, muscle stim, that'll get him in here, because we know that's probably not what he was thinking. More likely, he was thinking that, goodness gracious, I feel so bad for them. It's not a covered service. I'm just going to throw it in for free. But you notice right here that the government felt that it was about influencing those beneficiaries to receive adjustments. Now, whether it's what he did or didn't do, what's between his ears clearly was not what was between the government's ears. So he got off with what I think is a nominal fine of $80,000 because he violated the anti-kickback statute and in turn the False Claims Act. Now, through an odd set of circumstances, I actually ended up learning a little bit more about this doctor through meeting another doctor in their town, actually a doctor's wife in their town. And it turned out that this doctor was found out because he fired his CA. And the CA, in wanting to get back at him, turned him in and participated in a quitam situation where she could be a whistleblower, and then had the nerve to go to other chiropractors and try to get a job. So unfortunately, that's not an ideal situation from any angle that you look at it. However, what's most important to take away from this is what a very famous person named Dr. Ray Foxworth always says, and I love to quote him when he says, don't get stuck trying to do a good thing the wrong way. And that's exactly what this doctor was doing. Trying to do a good thing, providing assistance for these Medicare people. Most likely, I'm not in his head either, but I assume that. And, doing it the wrong way by just giving it away free. all of us certainly in this training understand that's what ChiroHealthUSA is for. It is the end-all, be-all savior of these kinds of situations, because a provider could very, very simply make their muscle stim $5 under Section 2C of their provider agreement in ChiroHealthUSA. And at least they're helping by doing something the legal and correct way. So remuneration, by definition, is under the anti-kickback statute, meaning anything of value. So that could be any type of a thing. Cash under the table, could be free movie tickets, it could be services. You notice down below you see where they say rent, free or reduced rent, meals, travel. I am on a listserv where I get kind of all the bad actors that come through from the OIG. And I saw something recently where back east, it was not a chiropractic practice, but a practice manager is who they actually got, who got in trouble. And what they could show is that they were referring to a particular laboratory for certain services, and this person had expensive purses. They had private jet flights to Las Vegas. So these are considered things of value for them, you know, for the lack of a better word, greasing the palms of that person sending their patients over there, for which Medicare or another federal program, by the way, that includes federal Blue Cross Blue Shield, mail handlers, all of that, not just Medicare patients. And unfortunately, that person got into very hot water. Now, you see here that it also talks about waivers of copayments, waivers of deductible amounts, transfers of items for or services for free or other than fair market value. Now, we know that this is a violation of inducement because, as it said, you cannot do that. One free exam, one free x-ray, this is a risk. Now, they do say no more than $15 per item or $75 in a year. Now, what I happen to know from working with a situation where we were asked to assist a client that was in an audit, had an opportunity to sit in a hearing with the OIG investigator. And while we were on a break, I asked them about this. I said, you know, we've got a lot of practices that, for example, like to do coat drives or food drives in the fall. If a Medicare patient were to come in and their adjustment was free that day because they happened to bring in some donation, what do they do about that? Why should everybody else get the opportunity to have the free adjustment and not the Medicare patient? Inquiring minds want to know. Well, for me, I thought it was obvious that that should be a stupid rule. And the guy said, listen, do you really think we care about that? Here's someone not even going to bill Medicare for that adjustment. We don't care that that visit's worth more than $15 when push comes to shove. But if we find out that that doctor has a coat drive only for Medicare patients and their new Medicare patients, and their exam is free, and they're doing it every Tuesday and Thursday, that's a different story. So it's where we take a good thing and we blow it up and make it bad. So understand that this is the guideline, giving away a goodie bag to every new patient that comes in, maybe a coffee mug with the doctor's picture on it, or a little biofreeze sample, or something that you're providing to everyone. Medicare doesn't care about that. That is not what we're talking about here. So it's good to keep that in your brain and to just look back and go, is this for everybody? Does it induce the patient in any way? Well, no, they're already here. It's a thank you for them. So recognize that regardless of what happens in the federal guidelines, as we've just talked about, almost every single state in the United States has their own anti-kickback statutes and rules related to inducement. Therefore, everything that we've just been talking about with respect to Medicare, federally insured folks, applies to pretty much everybody. So the best rule of thumb is to let the policies and procedures we're going to talk about here today be the policies and procedures of your entire practice. So one of the things I want you to kind of keep here is a little to-do list as we're talking, and this goes on your list. Review your state board rules for advertising, inducements, and free services. Most of them have one. Check in with your state association if you don't know. Check in with an attorney if you don't know. Call a compliance specialist like us if you don't know. But ideally, you want to get into the idea of understanding and documenting, hey, we weren't sure, we looked, here's what we found, and we proceeded under that advisement. And that will be a very good protection for you. So it's also important to know that most providers, if you're involved in an insurance plan where you are a part of that plan, are required to bill for the services rendered within that plan. So routinely offering free exams is likely a violation. Now, there may be certain payers. I know Blue Cross of Illinois had a statute at one time that you could offer a discounted examination as long as that discount was passed along. You know, the fee was the fee. It wasn't going to be raised if they had insurance. Also, almost every contract prohibits waiving co-payments and co-insurance. Now, keep in mind, we have to charge correctly. We have to bill it correctly, and then how we collect is according to our compliance policy. So unfortunately, what happens here is that we don't necessarily have offices that are going the extra mile to have their compliance programs in place and to say this is how we do it here in your SOP and in your policy. Likewise, deeply discounting services could be seen as a dual fee schedule. Your normal exam fee, let's say an E&M service is $100. You run a promotion that gives it away for $29. That could be deemed as an inducement because that's not fair market value, as we just talked about. So as we mentioned, that $15.75 is in place. So we cannot click past anything, it seems like these days, without seeing offers in Facebook, offers on Groupon, any of these kinds of things, things where people are prepaying. There has been a much deeper dive that we could take an entire afternoon on here about the way that Groupon fixed the problem they had, which was essentially a fee splitting scenario. Ideally, we want to avoid any federally insured patients when we do any types of offers. There was an OIG opinion that came out in March of 2012. I know of at least one consultant that banks on that and sells that as an idea. I personally and most of the other compliance specialists who are actually certified in compliance disagree with that particular type of an approach. I can tell you that, again, as with all things, it is where ChiroHealthUSA comes to the rescue so that you don't have to monkey around with that craziness. So providing that you understand what exactly is happening within your HIPAA program, that it is actually viable and valid. And unfortunately, if we haven't kept up on it, as with 9.5 out of 10 that we evaluate, your HIPAA program has to be viable and valid. And that means you're doing your risk assessments, you're doing all of those things. So let's just assume that it is for now, despite what the odds say. And I want you to just consider the privacy rule defines marketing in this way. So it's a communication about a product or services that would encourage a recipient of that communication to use or buy the service. So if it's marketing, then the communication can only occur if the covered entity first obtains an individual's authorization. Now, of course, this is not for people who are not your patients. So it doesn't apply if you were going to run an ad in a newspaper. You don't need approval from all those people who read it. But this has to do with your own database of your own patients. So the example they give, although not in chiropractic, I think is a good one. It's a hospital telling former patients, so part of a database, about a new cardiac facility, not part of the hospital, that could provide a baseline EKG for only $39. So this communication is not about the treatment service, providing treatment advice, for example. And it would have required authorization. Communication from a health insurer who is also a covered entity, promoting a home and casualty product offered by the same company. Again, that health insurer cannot do that to people without that information. So what's not marketing would be just an announcement about a new provider or a new piece of equipment. Maybe you bought a laser and you're just sharing that information with your database, not considered a violation. Notification of refill reminders for the supplement they purchased from you, not considered to be marketing. And then any face-to-face communication is not marketing. So if you tell them live in a visit about this thing over here, that is not a violation. So let's talk briefly about professional use of social media and all the risks and issues that kind of go right along with that, unfortunately. So social media is anything here. I laugh at the fact that MySpace is still a thing, but all of these are considered social media of any kind. And we can obviously use them in all of these different fashions because it is absolutely such an incredible part of our daily lives. So much so that I recently participated in an exercise to remove Facebook from my phone. If I wanted to get lost in that craziness, then I could do it in front of my computer, zoning out as I might by playing solitaire, right? The same idea. So all of these things are ways that you can use social media. And of course, it's awesome. I am friends with people I went to grade school with in 1970, early 70, 71, 72, 73. I am friends with people from high school. I am friends with people from college. A lot of that is because of that. In some cases, it's the only way I can keep up with some of my friends and what's going on in their lives. So there's nothing bad about it. But when we turn it into a business marketing piece, we have to understand that it is going to be bound by the rules of healthcare compliance. And so, it is very awesome if you have a Facebook page for your business. You can post, new people, you can post office hours, you can do closures, you can talk about all of those kinds of things. It also increases transparency. So you could be posting informational bites about a service or a particular type of adjustment. Maybe the doctor really enjoys taking care of carpal tunnel, and you can put educational material out. It does allow you to build that virtual community, and hopefully it works the way it was intended, and people share and recommend, and more people come and more people learn about your business. There are definitely sanctions that are associated with this, and any type of a board, we see it mostly on the AMA side, the medical side. Boards can discipline physicians for unprofessional behavior relating to inappropriate use of social media. So this also includes, I've abdicated that job to Sally over here, doctor. Well, you better know what Sally's doing on social media, because it really all comes down to you. It doesn't come down to Sally. So it's important to keep that in mind. Having inappropriate communications with patients online, which is anything whatsoever to do with their care. Use of the internet for unprofessional behavior, like unfortunately, we see all the ugly, dirty stuff that happens out there. And we, as compliance people, we sort of, collect some of these scenarios because you just cannot make some of this up and people don't believe it. But I found that as I am aging and getting toward the twilight years of my educational life, people really do enjoy real stories and to see things that happen. And sometimes we learn better from an experience share than we do from somebody saying, you got to do this. So I try to really incorporate a lot of experience sharing in, because it's a lot of experience for the size of our company and how many specialists we have, together with all of the years, over 300 years in chiropractic. We really legitimately have seen a lot, like that farmers commercial. We know a thing or two because we've seen a thing or two. Unfortunately, a doctor was actually in a chat room, and it spilled over into a social media site, and they were actually very heavily sanctioned by their board because of that. Misrepresenting your credentials according to the way that your board requires that you do. And then, of course, anything to do with HIPAA whatsoever. You may have a conflict of interest. Maybe you own the radiology center down the way and you're promoting it through your practice. That's a violation. Getting caught in what seems to be ever present these days with bickering and arguing and posturing on social media about, vaccinations or the political climate or Afghanistan or any of those kind of things, where you can get into an argument and it gets across a line you still have to be held to a higher standard because of your licensure. An online depiction of intoxication, imagine that. You're out at a bridal shower with your girlfriends and everybody's drinking and you got your hat on backward in something and that leaks out into social media. That is absolutely something that can be affecting you. So when something's posted online, information can be dissected, linked to, forwarded, shared, screenshots, etc. So you have to be very, very, very careful. Never really I would encourage you to avoid never really posting pictures of patients. If you do, you need written authorization. That is one of the things on the authorization side. So much of what we do in HIPAA does not require authorization. Treatment, payment, healthcare operations. But if they're going to write a testimonial or make a little video, always get that clearance and give us have them write out how long they can do it. Because interesting thing happened. We had a very unusual doctor approach us several years ago that they have the type of a practice, very, very specialty practice, where they might see one patient every 4 hours and they do some very in-depth work and they videotape that whole thing. And the doctor wanted to use some of the video evidence of, before and after, if you will. And unfortunately, what happened is that the authorization was invalid. They did not have a length of time for which they could use it, and the doctor didn't want to only do it for a year. They wanted it to be indefinite, and you can't do that. Well, I don't want to go chase that patient down and have them make a new authorization. Sorry, that's the way it goes. So always make sure the patient understands that they can remove anything that needs to be removed. Also important, these are kind of no-brainer things, but don't indicate or hint that you've treated a patient or are treating a specific individual, even if that person initiates for you, hey, I had a great adjustment, but I'm having a little headache. Should I use ice? It's going to be so easy to go, yes, use ice. You do all of that stuff offline, on the phone, in a private message or something. It's best not to post information regarding who's employed in your business or the solicitation things that need to happen. Also, this just goes without saying, keep them on separate places. You can do all that in a business page. Try to keep it separate from your personal page. Don't discuss topics that are outside your scope of practice. Don't give medical treatment advice to anyone, including patients or potential patients. And please try to keep it separate. Keep your personal separate from your professional social networking site. So what I thought would be fun is, although I'm not looking at all of you, I can certainly let you do a little exercise. So let's decide thumbs up or thumbs down here. In response to a patient review, in which the patient describes details of an office visit, the covered entity says, "Thanks for coming in," or "It was great to see you." Do you think that's a thumbs up or a thumbs down? I'll give you just a second to think about that. Since the patient stated that he or she treated with the entity, the covered entity, by saying "thank you," or "it was great to see you," has in effect confirmed the fact that a specific patient treated with the covered entity. This confirmation by the covered entity violates the HIPAA privacy rule. The covered entity has disclosed PHI without patient authorization. Now, it sounds absolutely ridiculous, and I completely agree with you, but don't do it. Patient review indicates that the patient has specific concerns. The DC wrote a Facebook reply stating, "Please call us to address your concerns." By acknowledging the fact that a patient had specific health concerns, it's a violation. Such concerns are PHI and may not be disclosed by the covered entity without prior written authorization, and that's a downer. Now, what could they have done? Indicating, so that the patient maybe here said, "I had a great visit, and again, maybe I've got a headache. Please call us to address your concerns." This is the issue, is they're confirming that. So watch what the better ways are to do it. A Facebook friend of the DC who is not a patient asks in an online post whether chiropractic can help with severe headaches. The provider responds with, chiropractic is fantastic and most headache sufferers respond well. Call me to address your concerns. Now, what do you think about this one? The friend is not a patient in the practice. Acknowledging the concern is okay because there's no relationship or PHI in play. This provider went the extra mile and didn't begin an online discussion of symptoms. That is a thumbs up. Patient posts a Google review of 5 stars and gushes about how much they love their treatment with Dr. X. The provider responds with, thank you for your feedback. We strive to provide quality service. Is this a line? It's okay to make generic statements about the practice, as long as such statements do not contain or sort of allude to PHI. They do not contain or confirm the details about the patient. That is an absolute thumbs up. Okay, last one. Patient posts a Google review of 1 star complaining about the practice and the long wait at a recent visit. The provider responds with a private message or email asking the patient to reach out to discuss. Yay or nay? This covered entity response is not a public disclosure and does not discuss PHI. As such, there is no privacy rule violation. Thumbs up by all means. Make sure that you don't drop into any of these kinds of scenarios, because although we are so used to being so reactive on social media, we have to remember that there is a veil that goes between private and personal. And I just really encourage that everyone understand that specifically. Employee use of social media kind of has to go along with the office's use of social media. A written social media policy is absolutely part of your HIPAA program. If it's not, you need to get that up to date. There have to be disciplinary repercussions for unprofessional use, and it needs to be spelled out, and people should sign off on that when they join your practice. Employees should not seek out patients to friend or follow on a personal basis. I'm very aware of this with other companies, even where somebody is required to have both a personal and a public page, even with a different company, because of who might see those things. And what can and can't be posted in relation to the workplace should be clear. There should be a training for all of your team on this as part of their annual HIPAA training. Some of the great things to do in social media are posting invitations or reminders about events or your condition of the week or any of those kinds of things. Introduce new services or products, like I mentioned, the laser. Introduce your team or a new employee with appropriate authorization. You could make a little video and let the person tell something about why they joined the practice. Share sales or specials. You're going to run a sale on your nutritional products in a particular month. Post updates. Maybe you've got a snow day or a holiday closure. And then, of course, education. It's called nurturing, not even marketing, where what you're doing is you're simply educating and being the resource for people. There's nothing wrong with that. This is a great social media disclaimer. And it is really important that something is listed on your own Facebook page or other page to this effect that outlines all the things that you really do need to be aware of to make sure that you have easily posted what you expect from that. So a lot of things we can't do. Let's talk about what we can do now. And let's focus on what we can do compliantly. And I really, I am sort of the anti-person on social media this way, because I don't use it the way that some people do with respect to, diving into every controversial topic there is. And try to remember this: what matters and what I can control, there's a very small piece of that Venn diagram that I need to focus on. So please don't just be frustrated or angry over what you can't do. Let's look at what you can do. So I think it's great to just do a lot of different things that go into your funnel. Lots of things that can happen to help people learn more about what you're doing. So I think it's important at this point to maybe just make a list of the things that you currently use and what else can you do? What else can you add to that? So this is a great example of a good friend of ours who put this together to talk about how that patients tend to be lifetime patients in many chiropractic practices, and what that looks like as you bring them in from these various types of external marketing scenarios, doing so compliantly, and then keeping them into what we call this episodic care loop. I love the idea of a marketing CA. Our good friend Frank Sardella actually wrote a book about how to train and hire and train a marketing assistant. You can certainly email this address. He offers this ebook at no cost to be able to learn a little bit more about just exactly how you might be able to have someone become that advocate for your practice. These are the ones that we love the most that I decided in our time together today that we would talk about. I'm going to dig into each one and give you some specifics on what these things are that you can do. And if these feel like a good fit for your practice, I hope that you'll consider maybe as you're moving into Q4 this year or even Q1 of next year, and you're writing your marketing calendar for the year, start thinking about how you would spread these out or incorporate them to keep your marketing legal and clean. Keep in mind that referrals from medical doctors are free. And depending on your relationship with the medical doctors in your community, I absolutely love, love, love this idea of actually just doing some simple things to stay in touch with them. So, for example, every new patient that comes in, it is a very simple addition to your intake paperwork to ask that person who their primary care doctor is, and would they be opposed to you sharing information back with that medical doctor about your findings. Now, technically, it falls under treatment, so you don't really need that approval, but I like to ask that because there are people that are like, I don't want them knowing I'm seeing a chiropractor, and you have to honor that. But for the most part, having that information should only be very, very straightforward and simple. So there are a lot of places you can get research studies and research information. Take an hour, download enough, that will get you ready for the next 6 months. You can go to PubMed. Foot Levelers has a ton of research. The Foundation, CCGPP, which is now called Clinical Compass, has excellent research studies. All of these different things that you can look for that have positive things to say about what you enjoy doing. A great example, a doctor that I've worked with in the past loves to treat carpal tunnel syndrome and actually has great results with it. So I'll share kind of how he went about doing that. So in your system, gather that information for the doctors that are in your area. Whenever, as part of your review of systems in your history taking, you ask about other conditions and who's treating them, that's sort of an idea to go, oh, let's have your name and the doctor's name and address. Add them into an Excel spreadsheet or a piece of your database or something that you can add information for. If you don't know the details, CAs can call. You see the scripting here. Hi, this is Sally from Dr. Smith's office. Mary Jones is a patient of your Dr. Brown, also treating here with Dr. Smith. He'd like to send over a brief report of the treatment Mary's receiving at Mary's request. I'd like to know if I can get the email address, or how do I make it easy for Dr. Brown? So you can scan it, you can do whatever you want to do, but this is how you kind of gather that information. We didn't say from the chiropractic office, we said Dr. Smith. And just continue with that and send those brief one-page reports with findings and the information. That's a wonderful thing that you can do. Now, when you get up to these research studies, I'll give you a great example. Let's say that you did the carpal tunnel and you enjoy that. And we've got this information and we say, Dear Dr. Brown, I'm attaching some interesting research that came recently regarding blah, blah, and tell an interesting fact. 42% of cases referred for surgery fail and require second surgery. Tell a fact that compels the doctor to read further. Chiropractic treatment is highly effective in restoring function to 75%. Now you go on to say, carpal tunnel is a condition I really enjoy treating and get outstanding results with. If you have advanced training, talk about it. In fact, tell a short story. Should you find any patients with carpal tunnel, we stand ready to receive your referrals. We'll be delighted to participate on your team in the treatment process. And you could even do a different one every month. Send a different thing out until they tell you to stop. Now the doctors that you've engaged with perhaps have the ability to say, look, I'd love to meet up with you. Can I take you to lunch? And begin to formulate those relationships, because relationship marketing is top of the line. And it's also the least expensive because it doesn't cost anything. The other advantage that you have here is maybe this guy doesn't even really know much about chiropractic, reads it and goes, that's interesting. And then who knows, a month from now, somebody goes, hey, I've been thinking about seeing a chiropractor. Do you know anybody in the area? Maybe they don't, except they know you because you came through on their mail. They go, well, not really know a lot of people, but I think this guy knows what he's doing. Off they go. So lots of ways that you can enjoy that relationship building with MDs in your area. Now, the second one we call a pre-acceptance interview. Keep in mind that anybody can come into your office and have a conversation. That is not the engagement of a service. I hate it when I see people say free consultation, because a consultation is actually a service. So we just call this a pre-acceptance interview. And essentially what it does is it allows you to invite a patient to come in, meet the doctor, learn a little bit more about the practice, let the doctor hear a little bit more about that. Maybe the person wants to talk about fees before this happens. In most practices that we know of who do this, you're talking 85 to 90% of people complete the rest of the visit as a new patient. Great opportunity for you as a ChiroHealthUSA member to be able to say, oh, no problem, Mrs. Jones. I understand you don't have coverage. Here we have this great program. Let me tell you about it. So have very minimal intake paperwork, some demographics, complaint, a little history. Set your expectations up front that at this point you're going to meet with the doctor, they're going to ask some questions, and they're going to determine based on those questions whether you would be a good candidate for chiropractic care. And it may be that there's time to continue the visit at that point, or perhaps a different appointment is made for the more formal initial visit, and there's a clear line of demarcation between the two if you go forward. Here's where the free stops. Here's where the charges start. And of course, at that point, you can explain whatever those look like. It is a very, very successful action. And it is also wonderful to avoid using the word consultation, free consultation. Those that are KMC University members of our library, you know that we have an entire training on that, kind of start to finish, and all the scripting and all of that in that section of Business Essentials. The next thing we encourage you to do is sell something of value. If you like to do screenings, if you like to go out into the public and educate and do things there, this is something that we love and that works really, really well and keeps you super compliant and clean. And that is that you can include non-E&M level services that have no CPT value per se. Set them as a part of your treatment or your fee schedules, and you can even offer a donation while doing them. So let me show you the details, and then I'm going to tell you the way that I think is a good way to do it. So maybe you have some of these various things that are here that are not necessarily relative to, the actual musculoskeletal chiropractic adjustment situation going on, that you can call that what your screening is, more of a health screening, a general health assessment, etc. So any type of non-E&M tools that are available in your practice, these are things that are very, very useful for you. So under this circumstance, we love using these codes 99401 through 99404. And what they do is they allow you to have something of value that is not your initial visit E&M office visit service. Of course, we know all of that changed in January. All of those rules changed, the compliance rules changed, the regulations changed, the documentation guidelines changed. So this actually fits very beautifully into that. So the 1 through 4 are really just the time values, 15, 30, 45, or 60. And it's described as a preventative risk medicine, counseling, or risk factor reduction intervention. So if you have it in your fee schedule, it allows you to actually sell it. So it could include administration and analysis of a risk assessment. It could very well be a face-to-face service where you talk about diet, exercise, etc., and provided by a physician or other qualified healthcare provider. That means like a nurse practitioner or a PA, mostly not in our practices. Then the advantage that you have here is that you could say at a screening, offer this for, let's just say, $20. And they pay for that service, and maybe at that particular screening you decide that you're going to offer a donation to the local humane society, because that's where the donations are funneled for today's visit or for today's screening. So they pay the $20, you donate all of that on their behalf to the local humane society. October is a great time to do this for breast cancer awareness, to go to Susan G. Komen or something like that. And you have actually offered a real service. Again, a line of demarcation, because now you've learned some things and you do a report. Based on that, they've received something for their value. And now the question comes down to, are you a good candidate for chiropractic care? If so, great. And then let's talk about what's next. Line of demarcation, fees going forward. Here's how it works. This is what I would need to do for a more formal evaluation. It's important to keep in mind there are some codes here. The old code used to be V70.0. Now it's a Z code that's an encounter for a general evaluation without certain findings. The assumption is there are no specific concerns. So you need something in your computer system or in the record to show what the diagnosis is, and it's just an encounter. The new diagnosis codes, of course, are coming out October 1st, and there are quite a bevy of them that are going to affect chiropractors. The lumbalgia codes have changed, the headache codes have changed. We'll be doing a webinar training on that coming up here in toward the end of September. But what's important to know is some of the Z codes changed as well. And so these are great codes to just say, here's what happened today. It's not really a condition. It's more about coding the encounter itself, because you need something. Now, if the patient's insured on a plan in which you participate, you may or may not be able to do these certain things, such as the screening, etc. Now, those are almost always going to be non-covered or excluded by a payer under all those circumstances. They are not an E&M service. So, for example, a Medicare patient, it's a great thing to be able to do to learn more about their situation and figure out whether or not they're a good fit for your practice. If you do a service as a part of being a part of a plan, these sort of acknowledgement to self-pay forms are important. Now, this is different if you're a ChiroHealthUSA member of their election to self-pay. They're two different things. This is about a non-covered service, etc. So ideally, you want to check into that if you're going to be doing these types of screening services and you are a big participator in third-party plans. Another one that I really appreciate and enjoy very much is the idea of working with specific self-insured employers. You can become friendly with them. You can go to their expos or health fairs. You can make an offer to employers when the employer says it's okay. You can be the person that goes in and does ergonomic screenings for them. There are many, many things you can do of an educational nature that are marketing. You can bring along a chair massage. You can do all of these things. But if you work one-on-one with an employer, get it in writing from the HR department. Just working with one of our specialists who is in the process of winding down his practice and just got a contract with a giant union. And he's going to be the provider of service for the union. And it's all pretty much cash paid by the union. But he did that by starting out at one of these health fairs for the union. So Another great thing is you can never have too much education. So there are many, many things you can do that are educational in nature, whether it's your healthy lifestyles workshop that you do regularly in your practice, how you promote chiropractic and yourself, but you can also do that in public. There are many opportunities that you have to simply get on a panel when you have healthcare discussions going on in your neighborhood or in your city. Chiropractor being out there offering educational lectures on hot topics. Now, I'll give you an interesting thing that's happening here in Colorado. You may have run across the infomercials on Sundays where they talk about these type of devices that are supposed to treat neuropathy, where they get on the legs and they're kind of a neurological compression situation. And many chiropractors that I know across the country are getting involved, offering that as an additional cash-based service in the practice. So if neuropathy is a hot topic, then why wouldn't we offer in our neighborhood, in our library, in whatever venue there might be, to do a healthy lifestyle workshop or a topic on neuropathy or on ergonomics or on flat feet or on whatever it might be, and do it purely as an educational offer. You can always make a post-lecture offer for those that are wanting to come in and get checked. And remember, quick screening at the opportunity is important. Let them fill out a little bit of information like we talked about. Yes or no, you're a good candidate for chiropractic. You could give out educational brochures. You could give out maybe some samples, and then you have someone there to see about getting them scheduled. Where you go wrong very often with these things is trying to offer the discount to induce them in. Do the pre-acceptance interview. That costs nothing. And by the way, who doesn't love a chair massage, right? So I always would drag a massage therapist along and let somebody, have a piece of that, understand as you're talking about it, your massage therapist probably is very well educated to talk about how chiropractic and massage fit together. Please be careful of inducement with massage if you ever bill that service to a third-party payer. So don't have a client that we worked with because they got in trouble with their board, and we were their appointed board monitor. And what they had done was they were giving away for people that came in on a certain promotion, they got a free massage, but they were billing massage over here and collecting from insurance. So the pricing structure was dual, and that created a major problem for them. So just always be careful with massage. There's good ways to do it. You just have to be careful. Probably the cherry on top of all of this goes without saying, and that is policies and procedures around these types of things that you do are going to place you in the 5% of people who do it properly. Because when you have it written out, when you have policies that your procedure follows, you will find yourself, should you ever have hot water over a mistake or over something that was unintentional, it's going to carry so much weight to show that you were not trying to do something illegal or incorrect. This office never discounts new patient services in this way. This office never does this. This office does this. When you have that information in play, it makes a huge difference. So we always recommend that you come up with a good policy that outlines this type of information. And I want to talk just real quickly about fees. As you know, we could do a whole hour on fees here, but keep in mind that time of service or bookkeeping discounts are a part of your financial system for cash paying patients if you only wish to do a 5 to 15% write-off. Now, there are definitely some states that allow a little more than that on non-federal patients, but again, it has to look like this. If the adjustment is, let's just say 50, 15% is $750, here's the payment. If you do not display this to the patient in this way, and all you do is say it's $42.50, they're going to get the idea that's what it is. And heaven forbid they have a car accident later and you're charging this full fee and they think you're doing something wrong. This is the reason why we are such proponents of something like ChiroHealthUSA. Not only are you able to avoid this limit, but it becomes a very clear thing. Because I have this card, I get this discount, not simply because I have a spine and a pulse and I walked into this office. This is going to look a little bit complicated, but it is one of the ways that we train offices to understand what your discounting options are. There's a lot of little, things at the bottom here. You can see that the types of patients or options that you have, there really are only these. They're really not more than that. There is a contracted fee because you're in network. Maybe you're out of network with a payer and you have certain rules that apply. You can do a 5 to 15% time of service discount, or better yet, be involved in ChiroHealthUSA. There could be a financial hardship discount or a professional courtesy discount. So for each of these different types of patients, and you see that we sort of break it out in such a way to understand insured versus Medicare versus non-Medicare, you're only allowed to do certain things. And it is very, very important that you understand what your options are and what the rules are, because healthcare isn't retail. And you have to recognize that there are obligations set upon you, and that when you're marketing and you begin to do these things outside of the norm, that's when you get your fanny in hot water, and you don't need that. So we have rules. It's just the way it is. And I can tell you that they are broad enough and deep enough that you can survive within them. You just have to do it correctly. It's just like the tax law. I'm going to tell you, I would never in a bazillion years try to do my own taxes. It's too complicated. And I have someone that goes to the study, has the CE every year, knows what's going on, and is going to understand how to do it in such a way that is legal, but the most advantageous to me. And frankly, that's the reason that people like us exist around compliance, so that we can understand what you're trying to do and then help you get where you need to go. So we always just really do encourage you to think before you act. That's super important. And honestly, it is more important to take that business side of your house one extra step to make sure before you dive into the deep end of the pool. As always, whenever we work with ChiroHealthUSA, we always allow for an offer for our discovery consultation to be discounted down to only $49. If you ever just have a question or an issue, don't have to be a member. We're offering the special pricing to get on with a certified specialist, talk about your question or issue, get that advice, and we're always happy to do that. So you can either call us or you can email info@kmcuniversity.com, and we'll be happy to honor that for having been a part of this experience today. And Christy, I thank you for inviting me to talk about this topic. I can get super passionate about it, so sorry if I went off.
Oh, are you kidding? This was fantastic. And I took notes. You always give the best examples. We always have so many different speakers who cover a wide variety of topics. And I think one of the things that I love most about you and have is that you use examples that everybody can relate to in practice.
Yes, thank you. I certainly think that it's interesting when we actually do have all of those different things that we've seen, kind of like that crazy farmers commercial.
I love those commercials. And I actually just say that of all the commercials on TV, every time one comes on, I'm like, okay, what's going to happen next?
Right. Exactly. There's some crazy stuff. And it happens in our profession too, right? So you can't make it up. The craziest things happen and you're just like, they did what? I can't imagine.
Right. And there's always like, there has to be more to this story, maybe.
Absolutely.
So I really appreciate that. And if you have any questions for Kathy about what she taught today, and just know that if you're like me and you think of a question like 5 hours later, like as you're falling asleep, like, well, why didn't I think of this? You have my email address. You can also email info@kmcuniversity.com. She has the most amazing team working with her. They are phenomenal. Phenomenal.
We do love our gang.
I love your gang. I'm counting down the days till I get to make a trip to Colorado so I can see my KMC family. At least the local ones.
To see you. Yes, at least the local ones. We'll be thrilled to see you. And it's too late. Too bad it's October. You can't get a Rockies game in.
I know. It didn't really work out the way that I wanted it to this summer.
That happens.
I know. I finally just took a break and I didn't even leave town. I did a staycation at home. Such a bummer.
Well, that sounds pretty good to me.
It was right before Chase started back to school. Y'all know how it is when your kids hit high school, all of a sudden you see their life flashing before your eyes.
I think so.
I realized we're closer to him moving out than anything else.
Ugh.
I don't
Oh
know.
dear.
I am. I'm going into panic mama mode. But anyway, I'm super excited that y'all are able to join us today. And again, if you're watching this on the recording later, again, y'all know how to email me, Christy@ChiroHealthUSA.com, or you can go directly to the source at info@KMCUniversity.com. We will have our next webinar in 2 weeks on August the 31st with my friend, Dr. Margie Smith. She's going to be talking about 5 ways to run a low overhead, high profit, stress-free practice. Look at that beautiful face. Doesn't she look stress-free?
Well, I'm so thrilled. We actually helped her with a couple of things to do that for her in her little one room after she moved. And it was such a delight to see her thriving in that space.
And she's a fun storyteller like Kathy. And I really love that about her and her enthusiasm. Just like you can feel it coming through your computer.
She's great.
I see it's the ladies of chiropractic right now.
I'll say that's a lot of girls right there. I like it. Girl power.
It is. We got some men coming along too. We're going to let them into the party. And then we're going to follow up. We only have one webinar in September with Holly Jensen, 5 ways CAs can help the practice thrive. And then we will have 2 in October, 2 in November, and 2 in December. And about October is when we will start promoting and putting out the podcast episodes. So stay tuned, everybody. So we are so excited you joined us today.
Thanks for having me.
I got to see you. And I hope you all have a phenomenal rest of your day, an amazing week. And if you're at FCA National next weekend, you make sure you stop by booth 7. You can't miss it. It's real big. It's bright orange. It says ChiroHealthUSA, and come say hey.
I'm sorry I'll miss you, but I hope we get connected soon.
Bye, y'all.
Bye.